Good evening, everybody. My name is Dr. Talbot. I'm a pediatrician at the Department of Health. I see your children from birth up until the age of 21, and I am acting in the role of senior medical officer since April 2020. So pretty much for the bulk of this pandemic. And I'm also a parent of a child in the public school system, and auntie and friend to many, many, many more. So I would really be very interested to see us keeping our kids in school and doing it in a way that makes sense. This first slide here is just to show you the difference between the two things that we're talking about. The one on the right, which we're not really focusing on today, that is a heated machine that's used in PCR testing in a lab setting. The one on the left is the antigen test, which is also known as the lateral flow device. Before we get into the technical bits, just some tips for using them in case anybody still has not been able to, or still not had the opportunity, let's call it that, to use a lateral flow device. So the main thing is that you take the time to read the instructions before you do it, because looking at it can seem quite daunting, but if you actually take time to read it, look at the pictures, and take that pause before you start, is actually quite straightforward. So the most important thing from my side to communicate is that you lay the device on a flat surface. And that's because when you take your sample and you add it to the solution, and then you add it into that little well in the test kit, that little oval part, you're gonna see a pale pink solution creeping up that paper. So if the device is not laying flat, it may not give you a proper reading, or you may think it's not working. Okay, so the other thing is to set your timer and come back to it when it goes off. Don't read it too early, don't read it too late. Okay, and so you can skip the next slide for me, please. So before we go into anything, it's important to really understand what antigen testing is, and to go there, we have to understand what is an antigen. So antigens are molecules that the body responds to make that immune response. Basically, it triggers the generation of antibodies. And antigen can be, it's usually a protein, but it can be a lipid sometimes as well. So there is a substance that's embedded in the test kit that's searching for the antigens from the coronavirus. Just like antibodies in your body, the ones on the test strip will bind to any antigen in the sample. If the antibodies that it finds belong to, if the antibodies in that test strip find antigens that belong to the coronavirus, it will bind to it and it will give you that colored line on the test strip indicating a positive test. So rapid, accurate testing is essential when you're trying to contain a highly contagious virus, like, as we all know, COVID is highly contagious. And they are accurate when you're using it consistently. You can go to the next slide for me. So this is going to just give you a brief overview of the difference between antigen and PCR. As we all have learned very recently, and in the hardest way possible, antigen testing is faster. Usually you'll get a result within 15 to 30 minutes. PCR testing, the results take time. In the best case scenario, hours, worst case scenario, several days. They're both able to detect positive cases quite well. Antigen testing, usually 80 to 90%, and then PCR testing is approaching 100%. So the real benefit here is that the antigen tests are super easy to use. They require no specialized training, and they're easy to interpret so long as you know what you're looking for, which is that second line. And then your PCR testing can only be performed by medical professionals and lab technicians in the context of a suitable lab. The antigen testing is much less expensive than PCR testing. And then the huge benefit for us as parents is the convenience. Antigen testing can be done at home, anywhere you have a kit and a person to be tested. Whereas the PCR testing, requires a lot of resources, a lot of planning, adjusting the schedules, queuing up in lines, and then that's just to get the sample, and then it has to be transported, processed, and those results still have to get reported back to you. That last line there is just to hone in on the science of it. And the point I want to get across there is that the antigen test requires enough viral antigens to be present in the sample. So it relies on you being infectious and having a decent enough viral load. Whereas the PCR test, it's amplifying fragments of the virus's RNA from the sample that was taken, and it can detect even the tiniest genetic evidence of the virus. The reason why the Department of Health is encouraging a move towards antigen testing is because of the volumes of samples needed to be processed, trying to screen people, and the need to have the results in a timely fashion so you can make decisions and action those findings. So the current approach, which is the saliva screening, it was suitable at a time when there were relatively low levels of accuracy. But during times like now, where you have high prevalence, you need to be able to act on results quickly. And rapid tests obviously can reveal a positive much faster than the attempt process. Now, the trade-off that you get in terms of accuracy, you gain from the speed of getting the result, and you gain from doing that follow-up repeat testing 2 to 3 days. So what that means in a practical sense is that if I test today and I'm negative, I test again 2 to 3 days negative, and I test again in a couple of days and it's negative, you can be confident that that person who has consecutive negatives is not infectious, they're not contagious. So I'll repeat that. The reason why we repeat the test is to reduce the chance of a false negative. Okay, and the opposite is also true. I can be negative today, test again in a few days, negative, and then I test again in a few days. If I'm positive that day, the day that I'm positive is the day that I'm potentially a risk to people that I share space with. And that's really what most people are worried about right now, is being contagious enough to spread the virus to other people. So we're all trying to move forward and start living with this virus instead of being terrified of it. It's amongst us now. We're past the point of containing and keeping it away. It's here, whether we like it or not. The global shift from PCR is to preserve PCR for what it was intended for: clinical use, hospital use, people who are sick, confirming a diagnosis, and not for using it as a screening process. Globally, antigen testing is being used as a tool of choice for community use as COVID becomes more endemic in our societies and we figure out how to live with it and despite it. And that's the end of my presentation. I'm going to stop talking now.